minutes.
Go ahead, Travis.
Good afternoon. I'd like to call to order the Health and Human Service Committee, Wednesday, April 16th. It's 1 p.m., our committee meeting. We have a call to order. Do we have any changes to the agenda? No changes. Is there any public comment? There is no public comment. The minutes approval from March 19th. Randy, Amanda seconds. All in favor? All right. Appointments. We do have a few appointments. Let me go down to the appointments. We have two appointments, Advisory Board appointments, ID 13115, Recreation Partnership Board, Travis Brooks, Legislator, term expires December 31st, 2025.
Travis, that one's already been passed. I think that you just have an older one.
Oh, is it just those two?
Is it this? Is it this?
Yes,
that's okay.
the one.
Oh, okay. All right, I'm gonna start over again. Appointment, Legislative, ID 13204, Advisory Appointments, Community Mental Health Services Board, Substance Use Subcommittee, Robert Groling, Community Member, term expires December 31st, 2027. Office for the Aging Advisory Committee, Joanne Isbecki, at-large member, term expires December 31st, 2027. We have a mover, Amanda, Randy seconds.
It'll be you and me today, I think.
It's gonna be one of those days. All in favor? All right. I don't have much for a chair's report. Over the last few weeks, we've had some great conversations with OTDA. They've taken time to come to several of our legislative meetings. We share about housing and funding and opportunities, answer questions. It's really been great to have them, make the time and come and be available for us. Office of Human Rights, the commissioners came last night and spoke very passionately about the work that they're doing over at the office. So I'm really looking forward to the suggestions from the county administrator, the recommendations on how to move forward with that office. On Monday, I shared our goals for 2025 with the Health Planning Council, the Tompkins County Network Advisory Board. They had some good questions, and that went really well. That's it for my report. County Administrator's report.
Okay. Thank you, Travis. So just to follow on from where you ended, myself, Charlene, and also have had several conversations also with the CJC. So we are putting together a draft outline of how the Office of Human Rights can respond to the current need that exists within the county, and also the way we have to reconstitute it going forward. So that will be a draft outline for your consideration. I intend submitting that to you all for your review before the next HHS meeting, so that if you have any processes that you feel we should attend to before any specific decisions are made, then you will be able to give us that direction. I'm working very closely with the chair of the Human Rights Commission to also get their input, so that you don't have a multiple proposals to look at, but you have one single document to work from. So we plan to get that submitted at least a week or two before the next HHS, so that we'll be able to have a candid conversation about the direction that we intend moving forward with. So that should be coming your way within the next week or two maximum in your emails for you to review and give a direction. So I believe in September or October, the legislature voted to provide $10,000 for people to use to pay for travel passes and a shower for people who are in need. We managed to work with GIAC to set up the shelter, I believe in February. or early March. So that has been in operation so far. We were able to identify some degree of support depending on where we land with our Cold Blue funding to be able to pay for that. So far, we haven't processed any invoice yet. But as you know, Cold Blue closed yesterday. The question that came in is, should the showers still be available to the people in need to go there and use it? And are we willing to continue to fund it? Based on the allocation of $10,000, we didn't come with a specific direction as to what time frame that money should be utilized. I believe that those funding, some of them is still available that we can tap into to provide people ability to use GIAC showers and maybe pay. So I wanted you guys to discuss that, to give us the direction where you want us to go with that, if we should continue having those shelters, those showers available for people to use, or what specific direction you want us to move forward with, because inquiries have been coming to my office as well at DSS, so we need clarity where we are. Was the funding attached to Cold Blue season, or is it something that we want to open up for people to still tap in as long as they have funding available within that allocation of $10,000? So there's an item that I would like you to discuss, and that, as the other things, I just want to update you is that the DSS commissioner position is still advertised until, I believe, end of next week. So far, we have like 15 applicants. Our whole health closed on the 13th. We, I believe, have 16 or so applications that we are going through the review process now. And we'll update you on that as well. And also, I will not repeat what Travis said in terms of OTADA visit. I think yesterday was very informative for us. And I'm hoping that we will, as we move forward, we'll continue to tap into all the opportunities that exist and see where we land in terms of providing housing, not necessarily shelter, but housing for those unhoused. And I think that is where we all committed to get into. The shelter is just an intervention, and we'll continue to explore all the opportunities that exist to make sure we're able to provide housing for the people that are in need. So the key item for conversation is the shelters and which direction you feel that we should be moving in.
Discussion, Brandy?
How long is GIAC going to be available for homeless people to take showers?
I will pivot that to.
My best guess would be up through the end of June.
And we have funds available right now for that?
Yes.
Makes sense to continue it if you can.
Yeah, I mean, if we have the funding and it's available at the moment, I think we should keep doing it. It might be something we need to check in on more regularly to make sure we have the funding and, you know, like that everyone's on the same page about that.
Yeah, absolutely. So the process that we set up is that I believe they have a sign-in sheet over there that people who goes in to use the showers sign in. They also will be sending us invoices. I believe we haven't received any invoice yet, right? Yeah, so we haven't received any invoice yet. The indication or the initial thought process is we are not paying for using the facility, but we are just paying for GIAC providing 2 temporary staff for 4 hours a day. So that's what we're paying for. So even if every day is housed with those 4 hours, we can actually calculate and know how much or how long the funds can allow us to be able to cover people, and I think the supplies that they build us for. So when we receive the first invoice, which I believe will be in a couple of days or weeks, nothing has come in, we'll have clarity how much that will be and how much of the allocation is still left. But I think we haven't really spent anything yet based on invoice that has come in. So when we receive the first invoice, we'll have clarity that how long any amount left will last us for. But we will keep our eye on it and make sure we are living within that 10,000 maximum that was funded.
Amanda?
Yeah, question back to the OHR thing. I saw an email thread from someone asking a lot of questions about the process, and forgive me if I missed this, but how how are we, other than here at the legislature and the Human Rights Commission, talking about it, how are we letting the public know that we're doing this, and that how can people voice their opinions about it?
I will suggest at the moment that if there's any specific opinion point to come to me, we haven't put anything out yet. What I wanted to do is administratively, internally, how we perceive the office's role based on what is written in the charter. And then working with the Human Rights Commission based on their relationship with the office previously and how they perceive an effective relationship should be like. So that is the point at which we are dealing with it. We are not really looked at how the public want the functions the office to be. We haven't done that engagement. My thought process is that the public engagement might be a bit more refined if we do that engagement through the Human Rights Commission. Because I feel that would be more of an open avenue for people to really express their views about how the office should act. So I was pivoting on the Human Rights Commission to provide that public input side of things, but I'll still leverage on your input as which direction you feel we should go based on the draft information that I'll provide. If you feel that you want to set up a committee, or if you want to set up a further conversation around it, or if we want to rely on input from the Human Rights Commission as more. I looked at, from the information I have received so far, it appears that there was some gap of a relationship between the office and the commission. The commission was not providing an oversight to the office, and the office has not also been providing more of a reporting or administrative function to the commission. Those gaps did exist. So what I'm trying to look at is how can this office act, just like with any other oversight committee or commission, how can this office provide that administrative function for the commission and also provide that relationship gap between the county administration and the commission. So that is how we're looking at it. And also, as I mentioned with the CJC, there are aspects of the CJC work that the community really excited about, like the community engagement. So even though the city is expressing a willingness to continue the work, there's aspects of the county responsibility that also will need to be maintained. So we are looking at, is it possible that the Human Rights Commission, the Office of Human Rights, can continue that task and working closely with the CJC so that we don't lose what has been successfully built yet?
Yeah, that's all great. I guess I would just, maybe it is through the commission that at some point there's a public comment period. Yes. Or, some way for people to, like, who are involved or who have concerns to give that feedback, and that can be incorporated, and or through WDIC too.
Yes.
I think
Absolutely.
that would be important.
Absolutely.
Thanks.
Randy?
Yeah, I'm not real familiar with the Office of Commission or Human Rights. I'm not familiar with what their structure is at all. But obviously people came here and they were quite passionate about what they were talking about and they were informed. Is there any reason that our Office of Human Rights isn't consolidated with the Human Rights Commission? I mean, do we have to have this department? Can we fund it through another operation? I mean, I'm just trying to, what makes sense?
So,
Question, I think.
yes, so that's the question, because my first encounter with the way the office was structured or was functioning was that bridge that did not exist. So the Human Rights Commission more unlike work like an independent of the office. So one of the simple questions that I asked was who takes the minutes for the commission's meeting? And I realized that the commission appoints a secretary within the members of the commission to take the minutes in their meeting. So there was that gap of engagement. So my hope, the way based on conversation that we're having, is that office providing that administrative arm of the commission so that the commissioners can rely on the office for information, for engagement, for coordination and those. And because most of these commissioners are volunteered members.
Right.
So it is important for us to provide them the resources through the office to be able to do their work. But it looks like the commissioners more like were independent of what they have to do, and sometimes they are not able to get that administrative support from the office. That was some of the information I picked up, could be the case or not, but I'm hoping that we can close that gap, but by weaving the office with the input from the commission so that the commission and the office relationship can be enhanced, whilst also the county as an entity can also be informed of what is going on, and also we can our support to the commission will be reflected through our support to the office.
What's the primary role of the Office of Human Rights? To receive concerns or complaints and to file them? Is that the general primary?
Well, it's changed over the years. And that's part of this, the discussion about how to move forward. I don't remember what year it was, but it was at least 8-10 years ago, I
I
think.
think it was right before I came on,
Yeah.
so 8 years ago.
Well, the old director of that office made the determination that we couldn't investigate complaints anymore. And there was all this stuff that happened, and that's when Dr. Clark came in when she resigned.
Yeah.
And so the function has looked different than it has in the past. And so I think at least since I came, the question has been, what should the office be doing? And so we're in a position now to actually figure that out. And I think that's what the idea is, that we will get recommendations and what seems to be the best way to move forward, and then we will kind of decide from there which option to go with after hearing from the community and everything.
Yes.
You would think it would make sense for people to issue their complaints here versus having to go someplace else? I mean, with the Office of Human Rights or whatever.
Can I?
Yeah.
Yeah, like legally they can't anymore. The state said that people cannot walk into that office and say, can you help me file a complaint? And this was like the big hubbub, was that in the past, the previous director and, the folks who worked there were actually able to help them fill out a form, and it became such that it was illegal for them to sit down with a person and fill out a form because the state said so. So they could say, here's a computer, good luck. And that obviously is not particularly helpful. And the state offices are not here, right? They're in Binghamton, I think. So that was a lot of the tension of what can this office do? And, what the public and what the community wanted it to do was not really what it could do. So it became even more contentious. And in terms of the commission, my feeling was that the commission was a bit overstepping what they were able to do too. I mean, they're volunteers. It's like the Water Resources Council or the Environmental Management Council or all these other. It's an advisory board, and they should be working with the staff to do programs or support the office or give feedback in an advisory capacity. And I think that also produced a lot of tension about, the commission wanted to be doing their own thing as if they were their own entity, but really they're a part of the county. So going forward, you talked about the staff being supportive, and I think we have to sort of steer back towards that model.
Yes.
Of the commission, our volunteers, they are wonderful, we need them, they interact with the public, they do programming, they're sort of that public face, but they have to work with the staff. They have to be supported by the staff, and yeah, there was a big
Absolutely.
gap there, yeah,
That helps, thank you.
yeah.
Any other discussion?
No, not from me.
Go ahead, Chris. Good? All right. Jeremy, We have a few resolutions from Whole Health, and then you can give any updates that you want. I'll start with the first one. Resolution to accept funding and complete budget adjustment, Whole Health Department, School-Based Mental Health Services, ID 13230. Do we have a, Randy? And Amanda. Go ahead, Jeremy.
Okay. This is, at this point, this is actually automatic state funding whenever we open a new school satellite. So with each new satellite comes funding, at least for the next year or so. And this funding can be used for either lost revenue as you're trying to build up kids there, because you might go for a little while and have to engage, or you can buy new supplies or computer equipment. And we're going to do a little bit of both, but we needed a lot more computer equipment to make it easy to work in the school than just a regular laptop. So that's where the majority of the money is going to go. And so, yeah, this resolution is just to accept that funding so we can go ahead and spend it.
Any questions for Jeremy? Randy?
Yeah, thank you. It's good to see that more mental health services are going into schools. Maybe, could you provide, and I see in this resolution that details where we currently have staffing at the schools. Could you provide a summary at some point of all the schools and how many people are in each school and how many hours they're, how many days a week they're there, or some summary of that? But, and beyond that, you mentioned here that this has been great and it's helped a lot of people, but what does that really mean? How is it really helps? How is it helping people, and what are the schools giving feedback? I mean, it'd be nice to know. I believe it is helping. I don't doubt that at all. But it'd be nice to know how it's all comes together.
Okay. Yeah, so we are, I think we've spoken about this before. We're preparing a report at least to provide you all quarterly. We just hired a new school staff member, and so everybody's kind of shifting their days around to cover more. And so once that's stabilized, I can get you certainly the caseload, right? How many kids are we seeing? How many hours are we spending? How many services are we providing? And then that last part is then you want to know the outcomes, essentially, right? Which we can definitely provide. I'll have to give some context maybe because of it's hard to do outcomes when school ends and then summer begins. And then how do you pick that up through the summer? How do you pick them up the next year? And how do you show positive outcomes when that happens is sometimes tricky, but I'll bring it. We definitely have the data.
Great.
Yeah.
Thank you.
Okay.
We ready to vote? All those in favor? All right. One down, one more to go. Authorization to renew pharmacy lease and agreement with Genoa Healthcare LLC, Whole Health Department, ID 13232. Do I have a mover?
I'll move this one.
All right, Amanda, Randy seconds. All right, Jeremy.
Okay. So this is, as hopefully you know, in our front lobby, we've had Genoa as a pharmacy built right into our building, even though they are an independent, so they sign a lease. But it's been a huge benefit to our clients to be able to walk out the door and not have to go to a pharmacy after that. We used to have the pharmacy on Green Street. That was where primarily our clients would go. But once that closed, if people are on foot, it's hard to get to that. So essentially this is just to extend that lease, but I just wanted to say it has been a pretty big benefit. They work very closely with our prescribers to ensure that the clients are getting the best care possible. And it's a pretty important service to us at this point.
Questions? That's great. Amanda?
It's not really a fully formed question. This is great. And it sounds like you have a long-standing relationship with Genoa. I guess I'm just wondering, would there be any reason to, why continue with them versus some other provider?
So Genoa is certainly sells himself as a mental health type pharmacy. So they have done this for other agencies, the exact same thing they're doing for us. Now, while they have to be a public entity and technically anyone from the public could walk in and get a script, their expertise is around psychiatric medications and adherence to those medications. So they offer things that, as far as they will bring the medications to the client, they will ship them pre-packed, they'll do all those things for free, essentially. So there's a big add-on service for our clients by people who are specialized in OMA and mental health psychiatric type drugs. So that's why we went with them to begin with. There are others like that now, but they're well established, and it is really hard to change a caseload of clients once they know their pharmacist to get them to go to another one too.
Yeah,
So
that's great, thanks.
Any other questions? All right. All those in favor, please raise your hand. All right. Jeremy, do you have any updates you'd like to share with us?
yeah, I wanted to just focus today on our fellowship program. There were questions posed to me that I should bring answers to today. So I wanted to just read a quick summary of what the fellowship program looks like at Whole Health, what the status is of the funding, because that's why it's coming up, and then what the next steps would be for planning. I might be too close to that. So Whole Health does have 4 fellows. They work in 4 different units throughout Whole Health, so they are working on completely different projects. They were slated to end at the end of next May, but they are funded through some of the COVID supplemental funding that has been ended early. And so they would instead be ending at the end of this May, pending a court stay, which happens tomorrow. So as soon as that occurs, we'll have a clearer picture of this. But to end that early has a pretty significant impact. When you have 4 fellows who can work full-time, you make projects that are better than if you had to fit it in with your current staff, right? So they're doing excellent, excellent work. I'll read the categories to you, but they're doing a lot of work. So one of them is focused primarily on RFPs around mental health type services in the community, and we have a ton of them right now. We have an oral health survey and work group that another one is leading, as well as lead prevention poisoning. We have public water monitoring and reporting that is new guidance coming from the state that we have to figure out, so the fellow is developing that for us. And then you guys have probably heard about the CHA chip 1,000 times, but the community health assessment and the community health improvement plan. One is working on that to make it we're involving a lot more of the public. We want to make sure that this is a better process, and one of the fellows is working on that. So they're working on very different things, and so the idea of them ending early is a pretty big deal to us. And we've been working with the state, and it comes down to really, we have 3 options. There's not necessarily other funding if this pending lawsuit is not in our favor, right? So we can contract with the state with some funding that we find. We can bring them on as staff with some funding that we find, or we can essentially have to end that up and figure out how to maintain that work, or end that work if we can't maintain that work. And so what we've done internally is essentially look through the entire Whole Health budget, and we've done forecasting for all of our expenses and all of our salaries to see if they do not side with us, if I can find the funding to extend them at least. And so once the court hearing happens tomorrow, by next HHS, I'll either be happily not bringing you a plan because I don't need to, or I'll be bringing you a plan with monies that I've found, how long that extends them, what the costs are associated. But at this point, we're taking the approach of not asking for more county funding, just through vacancies or other things trying to extend them. And we are keeping very close eye on how to prioritize these. We know where they are in the timeline, and as soon as we have a date when they would end, we could say which ones we'll accomplish and which ones we will not be able to accomplish. So they're doing excellent work. We don't want to lose them early, and if we can have a time that is in between there and we can get them all done, that would be excellent. I think I answered all the questions that you had.
Thanks for the update.
And I just want to add that working with Jeremy, what we're really trying to do, not just vacancies, funding available in vacancies, but vacancies that are funded, that we can shift the money across so that at least the county's burden is as minimum as possible, if any. So that is the approach that we are working through to make sure we're able to keep them if they need be, and also reallocate the funding in such a way that it doesn't really affect the local dollars, but other funding allocation that we have available.
Thank you. Anything else, Jerry?
I wanted to just focus on that today, just in case I have to come back next month, so.
Got you.
Thank you.
All right. Well, thank you for sharing.
Yeah, and thank you for being here in person.
Sure.
Absolutely. All right. Office of the Aging. Karen, are you here for Lisa?
I I am. Good afternoon.
Good afternoon. All right, we got 6.
We have 6.
And then you can give an update after that. So we'll just run right
Okay.
through them. Budget adjustment, Office for the Aging, budget decrease to Title 3B, program due 2024, final grant awards, ID 13210. Randy
Yeah.
moves, Amanda seconds.
Okay. So I just want to preface all 6 of these are for the same reason. Real quick, basically, we receive our tentative allocations for our 2024 budget in the spring of 2023. That is what we base our 2024 budget on. And then generally, we receive our final allocations in the fall of that same year. However, for the 2024 budget, we did not receive the final allocations until February of 2025. So these resolutions before you are the adjustments to our 2024 budget because of our late receiving of the final allocations.
Got it.
Okay.
Is there any questions? Because all these are pretty much be the same, so is there any questions now? No questions? All right. All those in favor of the first one? All right. Budget adjustment, Office for the Aging, budget decrease to Nutrition Services Incentive Program due to 2024 final grant award, ID 3211. Randy and Amanda? Any questions? All right, all those in favor? Move to the third, budget adjustment, Office for the Aging, budget to increase unmet needs, program due to 2024 final grant award, ID 13212. Amanda moves, Randy seconds. Any questions? All those in favor? All right, we are moving. All right, to the fourth one, budget adjustment. Office for the Aging, budget increase to Community Services for Elderly Program due to 2024 final grant award, ID 13213. Amanda, Randy, questions? All those in favor? All right, down to the fifth. Budget adjustment, Office for the Aging, budget to increase to the Title 3C program due to 2024 final grant award, ID 13214. Amanda, Randy seconds. Any questions? All those in favor? Final one. Budget adjustment, Office for the Aging, budget increase to Wellness and Nutrition, WIN, the WIN program, due 2024 final grant award, ID 13215. Amanda and Randy seconds. Any questions? All those in favor? Oh, you got a question? Oh, boy.
So these went through the Budget and Capital Committee as well. And we did, overall, I think it was an increase of like $175,000 in funding for what they planned, the minuses and pluses. But I was going to ask, of course, I can't remember where the money's coming from. Is state or Fed or a combination of both, or I couldn't remember, but the...
Rodney, if you want to take that.
Sure. So the Title III programs are federal and the rest are state.
So when you have extra funds, and you said this is for the 2024 budget, but it actually comes into the 2025 year, do you have plans for this extra money, or was this a complete surprise?
It wasn't a complete surprise because we had the tentative allocations to work off of in the spring. We just were never given final allocations, which obviously are subject to change throughout the year. We didn't see a change in our tentative allocations, but it's important to remember that the fiscal year on our state programs runs till March 31st of the following year. So our plan was in place to spend all of these funds. So, and I think we're pretty much close to it. The Title III programs have been sewn up as far as the increases, the added expenditures. Those are largely with FoodNet, Meals on Wheels, and I would say generally the way they operate is they throw in a lot of money from gifts and donations and program income for charging for meals, and generally they spend grant funding sooner rather than later. So they they front load all of their expenses and what they voucher us for to utilize the grant funding, usually by September or October. And that's usually about the same time we normally would receive our final allocations. So there was just extra money on the table. So for things that they did not invoice us for, we worked closely with finance in making the required adjustments to basically have them submit vouchers for the time periods that they normally wouldn't to expend the extra money. So.
Thank you. Appreciate that.
Okay. Is there any, did we vote? No. No. Is there any other questions? All right, are we ready to vote? All those in favor? All right. Karen, do you have any updates you want to share?
I'll share one actually, and I'm sure you'll hear about this in the future because it's not until July, but I just want to mention that this year is our 50th anniversary for COFA. So we're going to be having an event at the Hotel Ithaca and bringing back the Senior Living Expo in July. So we just put the feelers out to get some vendors. We're going to have a nice little celebration. We're going to have a panel discussion on a topic that's still yet to be determined, some falls assessments. So we're looking forward to getting the information out on that soon and hope that it's well attended.
Well, congratulations. 50 years is a big anniversary. That is awesome.
Yes.
Great work.
We're excited. Thank you.
Any questions for Karen? Karen, thank you so much.
Thank you.
All right, we're going to move to departmental updates. Adina's here in person. We're going to let her go first from DSS.
Okay, thank you. So just an update on shelter numbers. So our current shelter numbers as the end of March, we had 98 people sheltered in hotels. 81 were THA. There were 70 adults and 11 children. And then in hotels, we had 17 code blue. 10 of those were adults and 7 were children. At the Key Bank site, the Code Blue Warming Center shelter, in March, it varied because of the weather was kind of up and down and up and down. So we varied between like 25 and we had up to 32 people the past couple nights when it's been cold. And during the past 30 days, we were able to transition 26 Code Blue clients to THA. So
nice.
They're getting more stable housing and we're working with additional folks. And of course, so the shelter closed, so this morning was its official ending, and of course, as luck would have it, it snowed today and tomorrow, so we'll house people in hotels, and we have things set up with a local hotel and food for them and that sort of thing for the next couple days, so just so everyone knows that they'll still be warm. We just want to thank everyone. We had many county departments worked with us in putting together the shelter and keeping things running, facilities, IT, safety. So it was really an interdepartmental effort, and we were really grateful to everyone. We had really dedicated staff who were coming in. Sometimes, we had people call out sick or cars didn't start, so people were coming in at the last minute. And we managed to keep it covered. We always had enough people on staff to make sure people were safe. And I also just want to, a big shout out to our community members, faith community. We had a large number of congregations provide food. They provided food 4 nights a week, plus breakfasts. And then Food Friendship Donation Network helped provide food, and some other agencies. So I was like at the beginning when we were starting this, I was like, how are we going to do this? And reached out to people and had some key people reaching out to other people. And it was a little bit slow, but then it picked up some momentum, and people covered it, and they made really tasty, delicious meals for folks. So we're really, really happy. And then the last thing is April is Child Abuse Prevention Month. And so we're coordinating an information and open house for our partners. So it's not open to the public, but for the partners, and legislators will also get an invitation, again, just to show our appreciation for the dedicated work that people do with our child welfare services. That's all I have.
Thank you. It was a big lift. It was a tremendous lift to get the shelter up and running that fast and accomplish all of that. Thank you to you and the staff for making that happen and providing a place for members of the community to go to when we were dealing with that, the cold weather. So thank you. Any questions, any comments for Dina? All right, Dina, thank you.
Thank you.
We will go to Kate Shanks Booth from Youth Services.
Good afternoon, everyone. Just a few announcements. Our summer camp guide is being published today and will go live. It's on the website, so if you are looking for summer camp, someone to know what is out there, you'll be able to go on our website and find that information. I do believe that the print version is coming out today on newsstands, but if you have additional things to be added to that, you can still contact our office, and Donovan and Teresa will work to get that information updated for you if you have a camp. We are also hosting, it will be, I think it's Tuesday, April 29th, Tuesday or Thursday, at GIAC at 7 o'clock. We're going to be hosting Teresa Flores, who is a sex trafficking survivor and an author, and she has started a project called the SOAP Project, which stands for Save Our Adolescents from Prostitution. So we're bringing her into GIAC and hosting an event. She'll also be working with the SASSY group up on Cornell earlier that day to do an event up there as well. So it's free to the public, and we're really excited to have her. And then just to follow up, Travis and I are going to be scheduling a conversation in the next few weeks to discuss sort of staff capacities around the AYR indicator updates we're doing, community needs assessments, county needs assessments, and then also how that dovetails into a possible youth summit. So we're looking forward to those conversations and appreciate the support and the reach out for that, Travis, so thank you. And I think that's what we've got right now.
Awesome. What's the date again for the sex trafficking presentation?
It's April 29th.
Okay.
We are in need of a microphone with a sort of a speaker for her. GIAC apparently doesn't have one for rent, so if anyone knows where we could get one or rent it, that'd be awesome. So, other than that, we're ready to go.
I'll check with some folks from over there.
Thank you.
Hi, I have Rob letting me know that he can provide that.
Oh, okay.
Awesome.
So we have
Thanks,
some
Rob.
options.
I'll be in touch.
Any questions for Kate? All right, Kate, thank you so much. And I look forward to connecting with you in a few weeks.
Sure, absolutely.
All right, we'll go with Mr. Claiborne from Veterans Affairs.
There we go. All right, good afternoon. Can you hear me?
Yes, sir.
All right, good. All right, thank you. Excuse my just getting here. I had an appointment that ran over. Hopefully you got that message. But if not, I'm letting you know. Excuse me. We just had a busy month, but I will say for things that are coming up, we do have two events happening. Our Warrior Writers Tompkins group, which meets bi-weekly. Our next meeting is going to be the Tuesday the 22nd, 7 to 9 o'clock here at TCDVS HQ, so I'd like to say. And then next Friday, or that following Friday, the 25th, 4:30 to 6:30 will be our meeting for our Women Veterans Group. We had a lot of things happening last month, but instead of running the list down, I'll just say the biggest thing that we did was our March 31st, we did our salute to our Vietnam veterans, our big welcome home event, and it was in recognition of National Vietnam Veterans Recognition Day. And we had that we did that at GIAC, and we had a good turnout for that, and a lot of folks are still talking about it. It was a great event. I think those are the biggest things there, but we had a lot of other things. Probably one of the other things that we did, and we're probably going to do this again, is that we had a drop-in veterans law clinic that we did that in cooperation with Cornell Law School's Veteran Law Practicum, as well as Maury and the Tompkins County Attorney's Office. We did that once again in March, and then we'll be doing it again in the fall. Once that schedule gets set out, I'll be letting folks know. And then we also had our workshop for the new login process. I did that in cooperation with ClearPath. And what that is that allowed veterans who wanted to learn how to set up how to log into their new portal, into the portal, because the VA has changed its process on how you get in. So that was something that some of our veterans came through, and then we got calls afterwards for other people to ask how to do that. So I think we'll be bringing that back again.
Jay, I have a question. With the wire funds that you get, that's not affected by what's happening with the federal cuts, is it?
So far, no. Those come directly from the state.
Okay, good.
Yes.
I did hear some great things about the program at the end of March. Unfortunately, I got stuck with a tire and potholes in Broome County and couldn't get back. It's my third one since January. This is crazy. But I heard a lot of great things. So thank you very much for making that happen for our veterans.
Appreciate that. It's been my honor.
Randy, Amanda, any questions for JR? All right. Thank you, sir. Oh, wait, Randy has one.
I just wanted to say thank you, Chair. A person I know contacted the Tompkins County VA, and they had some issues and concerns and some mental health needs. And so after speaking to you folks, they were interviewed by the people up by on Trip Hammer, the new VA facility up there, and the person was offered 3 or 4 locations to go to, and they ended up in Bath, VA over there, and speaking to them, they've been there a few weeks. They really like it there, and there's a lot of services there, and they have a bowling alley and a library, and
oh wow,
and it's a big facility, 160 beds.
Big campus.
Yeah,
yes.
Big campus. So I just wanted to say thank you. So.
Well, thank you. I appreciate you sharing that.
All right. Anything else for JR? All right, sir. Have a good afternoon.
Thank you. You all, everyone, have a great one.
We will go to the Human Service Committee with Cindy. Good afternoon.
Hello, good afternoon. If my camera gets janky, I'm just going to turn it off. So please don't take offense.
It looks nice and sunny wherever you are.
Yeah, I don't know. It's just how the light's hitting my office. It's kind of weird. I will enjoy it while I can. So a couple of updates. The county community agencies funding application has been released. So this is the application for funding through Tompkins County, and all the not-for-profit agencies that serve health and human services needs are eligible to apply. Applicants have to demonstrate the alignment with county goals in their application. And I believe that Monica shared the new release with all the legislators, but just as a reminder, if there are community organizations that you're working with or that you're speaking with, please feel free to refer them to us, and we can help them, figure out the application process and go over the process with them. And the applications they can be found on our website, hsctc.org. And if anyone needs the link, I can send them directly to it. The applications are due on May 8th.
Cindy, I just want to say thank you to you and your team. I know I've gave you all a hard time a little bit. About the application process. I heard almost from day one from folks that they were out, they could get to them. So thank you so much for doing that work. It's made life really much easier for agencies, and I really appreciate you all making that adjustment and the effort to do that. Thank you so much.
Of course, you're very welcome. We appreciate the partnership and the assistance from county administration. So it's your process, and we're here to hopefully meet those needs for you. One other thing, I just want to kind of let folks know that, HSC is working very closely with the executive director leaders of our critical community organizations right now around all of the kind of the federal environment and the funding cuts, both potential and actual. We are really trying to come together as a sector to figure out how to kind of collectively respond and manage the things that we either know or we don't know. And it's been challenging, obviously, as you would anticipate, but we do believe there's kind of like strength in numbers, especially around kind of collective advocacy, how we can work better together, how we can fill the gaps we know will be there, how we can, partner with local funders and foundations more effectively and more collectively. So we're doing a lot of that work. And the other challenge, of course, is, there's a lot of unknowns right now. And but we are really trying to help organizations navigate through that and figure out how to mitigate risk, how to manage risk, how to, kind of leverage the resources that we actually have through HSC and through other organizations here. So, of course, all in the service of our kind of collective mission of community health and well-being, right? That's where we all come together. So we will continue to support organizations in those efforts, and hopefully we'll get some clarity and some direction at some point soon. And that is all.
Amanda.
Yeah, just thanks for that. I know there's a lot of fear and, people losing funding or afraid they're going to lose funding. And, if I was in that position, I would certainly want to talk to other people who were going through it. And so it's great that you're facilitating that. What does it look like for you, for the HSC and your programs in terms of maybe possibly losing federal funding?
Yeah. HSC has, 32 sources of funding. So we have a pretty diverse funding streams. Our biggest risk right now is continuum of care funding through HUD. HSC specifically as an organization does receive planning funds through HUD for mostly staff support, right? So our COC lead staff member, Liddy Barger, it covers her salary, and then the bigger question is kind of the COC funding that flows through us to, the dozen organizations that receive it. The TC Actions, the OARs, all the housing, supportive housing providers. We're working, we have multiple resources around that, that we are kind of, utilizing. There's a lot of state organizations that really have their finger on the pulse on this. So a lot of legal webinars, things like that. So, so far, fingers crossed, from what we understand, the funding for the fiscal year of the federal fiscal year of 2024, which is kind of like our annual year, is kind of safe for now, if you want to say that. So we are definitely keeping a close eye on it, though. But for us, there's a lot of other organizations in town that do receive federal funding, whether direct or indirect, and they're like multi-millions of dollars at risk. So we're doing what we can to keep that information flowing to folks.
Thank you.
Go ahead, Randy. I'll wait too. Go ahead.
Yes, Cindy. I spoke to John about the Enfield Community Council and the Danby Community Council and the Caroline Community Council, and because it was recommended last year that if those entities want any type of funding from the county, they need to go through the HSC. However, that I've been told that maybe that's not the case, that those entities would have to go through the library. So none of them have libraries. So do you have, should they be, because I did get your email with the application attached, and I circulated it, but on the community councils, should they even be applying through the HSC?
Yeah, well, Randy, you know what? How about, I think, why don't we talk offline? Because I think there was some confusion because I believe that we were understanding that they were looking for support for their library or their library programs within the community centers.
No, they have reading rooms. They're looking for support for programming, for youth programming, senior programming. For example, Enfield Community Council, the health department, mental health has a satellite office there that they meet people in that building. I don't know what's going on in the other ones, but I mean, it's a community space. So they're volunteers running these community councils. So.
Yeah, then I would definitely have them reach out to John Mazzello directly, and he can for sure talk them through that, because I know there was some stipulations around the reading rooms because they had some sort of connection to the Finger Lakes library system. But if it's for general operating support for the community centers, I would believe that they would be eligible for that. But John can give them more detail on that for sure.
Great, thank you. And the other one is Tompkins Food Future. So the county has a food system plan, Food Policy Council, and the county's been funding that through CCE. Well, Tompkins Food Future is moving to the food bank of the Southern Tier. And so I'm recommending that CC not ask for that funding through the county, because if that Tompkins Food Future program is moving to the food bank, they should, if they want funding to continue this person and position, should they go through the funding that Southern Tier Food Bank already does through HSC? That makes sense? Or?
Yes. I mean, if the program is moving to a different organization, then the food bank of the Southern Tier could apply for support for that particular program in Tompkins County. So yes.
Okay.
That would be eligible they'd be eligible to apply for support for that program.
Okay, thank you.
Yep.
So I just want to lift up the continuum of care. We have an amazing continuum of care in this county. Every time Liddy I'm in a meeting with Liddy, and she talks about housing, the knowledge that she has, and it blows me away every time. There's just so much information that she has. So I just wanted to give the continuum of care a shout out and Liddy and the work that she does. It really is amazing.
Thank you. We appreciate that. And I very much appreciate Liddy and her very big brain.
All right. Any other questions for Cindy? All right. That is
Thank you.
It for departmental updates. We have the minutes approval.
We did minutes.
We did minutes. Okay. That's right. We did. I'm getting anxious. Do either one of you have anything that you would like to comment on or share? Randy?
I will. I was contacted by a constituent that had some environmental concerns at a property they own in a manufacturer-owned park in Shelter Valley, and they had contacted our state representatives, the United States representatives, our environmental health. They've contacted Soil and Water. The DEC's been to this property, and it's all around. And so I went there. Finally, I was on that string of people. They wrote to 40 different professors at Cornell about vibration and what they thought was an earthquake in their area. And so after a lot of research, the health department can't really do anything. They don't have any testing for vibrations and that kind of stuff. And the DC doesn't either, but the U.S. Geological Society does. So after all that, they are going to do some testing, I hope, in that area. 4 or 5 homes there are having constant vibrations, and they don't understand why. And it could be a lot of things. The town put a big water tower above it a couple years ago. Who knows what the reasons are? I just wanted to share that. I really appreciate all the people that were really jumping in to try to solve this. The county was there from various departments trying to figure this thing out. So anyways, I just wanted to thank the county employees for trying to figure this thing out, and it's not an easy one. So, you have anything, Amanda?
All right, we are adjourned.